Hello friends, I am Dr. Gunjan Manchanda, Assistant Professor ENT. My topic is lasers in ENT. Laser is called as light amplification by stimulated emission of radiation. It's an electro-optical device containing a lacing medium that usually comprises gas or a crystal, which when stimulated produces electromagnetic radiation or photon in a narrow beam. It's collimated, pure monochromatic single wavelength. This beam can be focused on smallest possible spot by a lens or a concave mirror, producing extremely high densities. This dense energy can be used to ablate tissues. Shorter the wavelength, greater the tissue penetration, and above 100 degrees Celsius. Lasers cause vaporization, carbonization, disintegration, destruction of laser irradiated tissue with smoke gas generation. Its thermal effects can be used for coagulation, cutting, and evaporation. In surgical lasers, the light emitted is in the range of 200 to 400 nanometers near UV radiation, 400 to 700 nanometers in visible radiation, 700 to 1000 nanometers in near infrared radiation, more than 1000 nanometers in infrared radiation. Biophysics of lasers. Light has a waveform. Distance between two peaks is called as wavelength. Height between the two peaks is called as amplitude. Height of the peak of the wave is called as amplitude. Power source gives rise to energy to the system or the lacing medium, which emit the photons emitted strike the atoms of the lacing medium. This raises the electrons to a higher energy level orbit, and as the higher energy atom produces another photon, and this is how the cycle goes on. So here on the left side there is a reflecting mirror, and power source is applied to the lacing medium which is inside this optical chamber. So laser beam is delivered on the right side. Tissue effect of laser. From center to periphery, when a laser is applied to the tissue, laser crater is produced. Here the tissue is vaporized and few flakes or debris are seen. The zone of thermal necrosis, which is 100 micrometers wide. Zone of coagulation, a volume of thermal conductivity and repair, 350 to 500 microns wide. Here small vessels, nerves and lymphatics are sealed. Then this zone of coagulation helps to obstruct the spread of cells via lymphatics and thus prevents post-op bleeding. So this is the diagram. So the laser beam is applied over here. There is a central crater of vaporization. Then there is a peripheral crater of coagulation and hyperthermia on the other periphery. So the other thermal effects are the laser energy is also absorbed by body's chromophores, which then gets converted to heat. This heat causes denaturation of proteins. which causes hemostatic effect due to contraction of collagen in the vessel wall and perivascular region. There are some non-thermal effects also. For example, biostimulation. Here, low intensity lasers like nitrogen and helium lasers can be used to produce mild stimulatory effects in tissues of inflammation. So the types of lasers are, one of them is argon laser, which was very extensively used earlier. It's a blue green light, visible spectrum, 488 to 514 nanometers wavelength. It's absorbed by hemoglobin and melanin. Used in photocoagulation of port wine stain, hemangioma, telangiectasia. It's used in stapedectomy, tympanoplasty. The mode is continuous. So there are different modes in which laser is administered. It could be a pulsed mode, it's like an on-off mode, and it's a continuous mode. So here there is a continuous mode. It can be delivered by optical fibers. Next is a KTP laser or a 532 laser. It's potassium titanyl phosphate laser. It's a solid state laser, so the laser medium is in solid state. Just like the argon is a gaseous laser, the lasing medium is a gaseous state. So it has a visible green color. It's delivered via a fiber optic cable used to excise benign or malignant tumors of the oral cavity, nose. It's also used in FEST, tonsillectomy, turbinectomy, stapedotomy. Another type is a carbon dioxide laser, which is used over here sometimes. It's an infrared laser, 10,600 nanometers. It's most widely used laser in ENT, and it's used in microlaryngeal surgery. Next is an ND-YAG laser. It's an infrared laser. Its wavelength is 10,600 nanometers. 50% of its energy is absorbed in tissues and used for hemostasis. It's used in tracheobronchial and esophageal lesions. Holmium YAG laser is 2100 nanometers wavelength, delivered by optical fibers. It has a short penetration depth. It's used in facial nerve decompression surgeries, endoscopic sinus surgeries. It ablates the bone easily. Safety measures. Use of so many lasers involves some safety measures which have to be followed in OT or by the surgeon handling that laser. So any education and training of the operators and staff is necessary. The operating room should be designated as laser control area room. Should be locked during procedure. Instruments and room should be energized in black finish. Room walls should be rough and non-reflecting. Protective eyewear for all the personnel. Saline-soaked eye pads for the patient. Inflammable substances should be removed from the operation theatre. The endotracheal tube is wrapped in aluminium foil. Tracheostomy and direct tracheal intubation is done to avoid accidents. Halothane is the safest anesthetic gas with laser. Scalpel laser is a surgical tool. Scalpel can only cut. Electrocautery can only cut and coagulate, whereas lasers can cut, coagulate, and vaporize. Indications of laser in ear. Carbon dioxide or KTP laser is used in stapedotomy, ossicular sculpting, adhesiolisis, granulation ablation, control of bleeding. In nose, it's used in inferior turbinate plasty, epistaxis due to hereditary hemorrhagic telangiectasia, endoscopic sinus surgery, dacrocystal rhinostomy. Laryngeal application. Benign lesions of larynx including laryngeal papillomatosis, sublingual stenosis, laryngotracheal stenosis, etc. Malignant lesions can be excised effectively with carbon dioxide or KTP laser. Bronchoscope application. In bronchoscopy, there are stenosis webs which can be removed with carbon dioxide or KTP laser. Vascular tumors can be treated with KTP laser or Nd:YAG laser. Oral cavity. In oral cavity, it's used to excise tumor on the floor of mouth, buccal cavity, or the labial mucosa, lateral part of the tongue. Photodynamic therapy. So here a light specific drug is administered, or a light sensitive drug is administered in the system of the patient. This drug gets concentrated in the concerned cancer cell, and when the drug saturated cell is exposed to a particular wavelength of laser light, the drug interacts with carbon or it interacts with oxygen and destroys the cancer cells. Thank you, friends.